Welcome back with us tonight on In Focus. The World Health Organization has estimated that almost 800,000 people die from suicide every year. That's basically one person every 40 seconds. According to studies, men have the highest suicide rate in the world. Joining me now to probe closely at this frightening number is clinical psychologist Kemp. Chris, good to have you with us tonight on In Focus. Now, across the world, men have the highest record in terms of suicide cases. Is there a reason behind that?
Yeah, absolutely. I think with something like 4 times the number of suicide attempts, actually, there are more women, but death by suicide, there are more cases for men. There's quite a few reasons behind that, but obviously if you're looking at a number that big, where 4 times the number of actual deaths by suicide are men, then you have to think, okay, there's something in this. There's something we need to understand. A lot of it comes down to the way that men are prone to kind of process emotions. I think everyone knows the stereotypical idea that men tend to keep things inside, or boys don't cry and things like that. But it's sort of stereotypical in that sense because it is the reality, and in a lot of cultures especially, it's looked down upon for men to be emotional. They need to present strength at all times. And what we find is that often results in men not necessarily seeking help, keeping these emotions inside, and when they do sort of reach a point of suicidal thoughts or suicidal behavior, they tend to keep it to themselves and follow through on it without speaking up and saying, hey, I'm actually having these thoughts and feelings. They also tend to be more violent in their methods of suicide, which are, I'm hesitant to use the word effective, but more likely to be fatal than what we see with women. Women are more likely, for example, to overdose, whereas men are more likely to use a firearm or something like that, which has a lot higher rates of actual death. Also, men have more access to things like firearms generally than women do. They're more likely to own a firearm. So there's quite a lot of things that go into it, but I think one of the most important things to understand is how little men are actually reaching out and asking for help, and that's the big issue that we face most of the time.
So, I mean, largely that also associated with stigma, isn't it? The role that stigma plays, stigma of suffering mental health issues in societies. Do you find there is a difference maybe in certain racial groups than in others where there's more acceptance now of mental issues?
I think absolutely in terms of cultural groups, and so, for example, Africa has very high suicide rates, and we've seen a lot of discussion in African communities and things like that, that mental health is something that is often kind of sidelined or sort of pushed to the side in the kind of sense that you should sort of get on with things or get over it, or it's sort of seen as a sign of weakness. So culturally, as a society, we sort of need to emphasize the importance of mental health, to destigmatize it as some sort of weakness. And some countries are more, and cultures are more successful in that than others. And also, unfortunately, it depends how much resources a country has to throw at something like that. So a lot of developed countries, they have a lot of suicide awareness, and they push all these campaigns and all that stuff. It can be effective, but obviously it requires resources. Here in South Africa specifically, we certainly have a culture of mental health being neglected, and I think perhaps even more detrimentally is that when people actually do want to access help, they often don't have the resources to do so, or the resources simply aren't available. So there's a lot of things combining there, but certainly in terms of different cultural groups, you certainly get different levels of acceptance in terms of not necessarily suicide, but just discussing mental health in general, discussing emotions, or if you're coping or not.
Yeah. By not giving it enough attention, what do you mean? You know, we saw during the hard lockdown, the helplines receiving a huge number of people in distress while they were stuck in their homes, and it alerted a lot of experts and certainly psychologists of the deep sense of mental health issues that we are facing in this country that have not even begun to be addressed yet. So by neglect, I mean, you're saying we just don't have enough resources, we just don't have enough psychologists, we just don't have enough places where people can go and air out these issues?
Yeah, absolutely. I mean, I think as a country, as a sort of healthcare infrastructure, we've certainly prioritized sort of primary healthcare, so hospitals, things like that. But within that structure, there's very, very little mental health resources. So I've worked in the public sector to some extent, and there's just very, very little. We had huge waiting lists and things for people to see psychologists and things like that. And the more rural you get, the more further out you go, the less likely you are to encounter any healthcare, not healthcare, but mental healthcare resources at all. And that's really the biggest issue. In a hospital, a huge hospital, you might have a handful of psychologists working there, and that's in one of the big government hospitals. So there just really isn't a lot of resources dedicated to that, and the result of that is that most psychologists who qualify in South Africa will go into the private sector, not necessarily by choice, but because the jobs, the positions simply aren't there. The hospitals don't have placements for psychologists, and so that means that accessing mental health care in South Africa is very, very difficult if you do not have the funds to do so, because you have to go private. And that obviously creates a massive disadvantage to anyone from a lower income background, because they simply can't afford to access mental health care the same way they might be able to access primary health care. Yeah. So it's a massive concern, and certainly I think a massive contributor to the high suicide rates that we do have in this country.
Still with this issue of the pandemic, did we experience a special type of mental issues during this time of a pandemic, and how did they present themselves?
So I think what's been really interesting about the pandemic and mental health is that everyone expected a spike in suicide rates that we haven't necessarily seen. What we have seen, however, is certainly a spike in sort of, I guess I could call it psychological distress. I know, for example, SADAG, who runs a helpline where people can call 24 hours. They, for example, saw tripling, quadrupling of the number of calls they got in a day. The suicide rates themselves haven't necessarily bore out. There's a lot of theories behind that. For example, the fact that we're all going through it together. For example, in wartime, suicide rates are lower as well, because people feel like they're going through a crisis together and everyone's suffering. We're kind of in this together. But my biggest concern is not necessarily in the midst of the pandemic, but in the years following. We're going to see the economic impact. We're going to see the impact on jobs and livelihoods and things like that. And those sort of things like financial distress, those are massive contributors towards suicide. And so I'm very concerned actually about the fallout of COVID, rather than being in the grip of it, but the fallout for years to come, especially on countries like ours, which are sort of lower income countries with less resources to sort of bridge that gap. Yeah. So I think it's a concern right now, but even more of a concern potentially moving forward, when the sort of big suffering phase is over, but the ramifications are being felt by the people who sort of are the most affected by it. Yeah.
On that score, while we're on there, we're in this together, the support that you require, job security, income support, are employers playing their role to make at least employees suffering from mental health issues that we are in this together? So work support for people suffering.
I think it's very hit or miss depending on your employer, which I suppose is the case with most things that you would want in a company profile. Unfortunately, and I think the employer situation is sort of a microcosm of the larger issue, which is mental health is simply not prioritized in general. It's one of the first things that people would cut. So it's great if you're a big bank or a successful business to have kind of an employee wellness program, and we care about mental health. If you're a struggling small business, you simply are not going to do that. You're looking out for yourself, and you're doing your best to stay afloat and stay alive. So stuff like that would be one of the first things that many people would cut. And if employees are struggling or not performing, they are simply going to be, removed from their position at some point, and someone else is going to be brought in. And I think that's the really, really difficult part when you have high unemployment rates, when everyone is struggling, when the resources are stretched. You're looking at a situation where people start to kind of have to worry more about themselves, and then there's less outreach, there's less support. So I don't want to sort of say that employers are not doing enough or kind of blame them without being sort of cognizant of the fact that they might simply not be able to do enough, because again, we loop back to mental health care services being really expensive and really hard to access. So for an employer who's struggling during COVID times especially, it might just not be feasible. And unfortunately, like I said, it's often one of the first things to go, I feel like.
What are some of the initial and most important interventions for someone suffering in silence, particularly men right now?
I think the biggest thing is of course, when it comes to suicidal thoughts or depression, nobody can really necessarily help a person unless they're willing to reach out and talk about it. So what you're wanting to do is create a space for them to do so. If you feel like someone that you know or someone who's close to you is struggling, try and sit them down and say, hey, I've noticed that you're not doing okay. You know, would you like to talk about it? And try and create that safe space where you sort of are communicating to them. First of all, I recognize that you're struggling, and second of all, that that's okay. So as much as possible, we want to be tolerant of people struggling and not tell them to get on with it or you know, pull up their socks or whatever the case may be. And maybe counterintuitively, what we need to not try to do is try to fix the problem. Don't tell people to go for a walk or, you know, get some fresh air or, you know what I mean. Don't try and cheer someone up, because that tends to often make it worse because they feel like you don't understand what they're going through. So rather try and create a safe space where they can actually share what they're feeling, and that you as the listener can sit with the discomfort of that feeling without trying to take it away from them. But if you're looking for warning signs in people, I always encourage people to just look for any kind of a change. Has someone become more irritable? Are they more withdrawn, for example? Have you noticed a change in their habits if it's someone very close to you? Depression can sort of manifest in many different ways, so it's best to look at someone and say, hey, has there been a significant change from the baseline of how I know this person? And then just try and create that space, especially as a first step. It can be huge just to feel supported.
Clinical psychologist Chris Kemp, appreciate your time and illuminating that conversation for us tonight here on In Focus.